Hello everybody, welcome to my channel. I will be discussing skin problems associated with mental health and some solutions to minor skin problems. We all have to look after our skins, especially in this pandemic, and there are minor issues with skins and how this can be addressed, the mental problems associated with these skin problems, and what easy topical treatments are available, along with what other help can be provided to people suffering with a skin problem associated with a mental health problem. Skin disease is not just a physical problem, it affects people's lives from nursery, school, and also relationships, and affects their career choices. Skin problems lead to anxiety, which is why psychological treatment becomes important if skin issues are not cleared after months of topical treatment. There is a greater need for mental health support for people with skin problems. Almost 99% of people in a survey reported that their skin condition had affected their psychological and emotional well-being. Around 90% reported that skin problems affected their well-being along with feelings of hopelessness, and 5% reported ideas of suicide. It is a psychosocial problem that is often minimized by clinicians as a minor problem or a cosmetic problem. Nearly half the children with a skin condition have not been offered emotional or psychological support, and around 25% of UK population consult a GP yearly for skin problems such as acne, eczema, psoriasis, and many of these are managed in primary care, means without being hospitalized. Not many general practitioners have the knowledge of psychodermatology. As a pharmacist, we try to identify these patients struggling with a mental health issue as a result of a skin condition by listening with empathy. This allows people to open up about their mental health concerns and allows pharmacy team to signpost them to appropriate resources and support. Peer support, mindfulness, cognitive behavioral therapy, and habit reversal are some of the management strategies for psychological symptoms. Organizations and charities such as National Eczema Society, British Skin Foundation, and Association of Dermatologists can provide help and signpost for better skin treatments. Some people are helped in understanding what triggers their flare-ups and how to keep symptoms under control. In pharmacies, we help people select the right product for the skin condition and refer them to their GP where needed. Any patients with eczema, scarring, acne, psoriasis, rosacea, who have moderate to severe skin problems are referred back to their GP or advised to see a dermatologist. Patients with these conditions are more likely to experience anxiety, depression, poor self-image, and difficult social interactions. For itchy, red, sore, and cracked eczema, the first thing to do is to control the trigger factors by identifying the allergens, weather changes, household chemicals, and clothing. Using proper emollients and soap substitutes, as well as moisturizing the skin with fragrance-free oils, creams, lotions, and ointments are advised. Psoriasis can affect many parts of the body, including nails and joints. Around 1 in 50 people suffer from psoriasis at any point during their life. It is possible that it is an autoimmune condition where the skin cells multiply rapidly, resulting in pink or red patches with silvery white scales. It can be triggered by infections, stress, intense sunlight, alcohol, and some medicines like antimalarials, beta blockers, and lithium. Topical creams, gels, and ointments help minor to moderate psoriasis. For more severe and extensive cases, phototherapy using ultraviolet light, tablets, and injections are recommended. Patients with psoriatic arthritis are referred to rheumatologists. Topical emollients soften the scaling and allow more active treatment to penetrate and treat the inflamed skin. Advice on lifestyle issues such as alcohol intake, and weight loss where there is an overweight problem have helped these situations to some level. Rosacea affects 10% of people in the Middle Ages and is more common in lighter skin and in women. Blood vessels dilate and cause redness or blushing on cheeks, forehead, nose, and chin. Some people get red or pink spots with pus. Skin can become sensitive, and so treatment would include gentle skin cleansers and simple facial moisturizers. Single ingredient creams containing nicotinamide or azelaic acid are recommended. It can be triggered by sunlight, and so using a sunblock SPF factor 30 or 50 with a good UVA protection is the key. More severe cases of rosacea are treated with antibiotics, both topical and oral. Specialist clinics may offer light or laser therapy as well. Acne treatment. Most people at some point have acne, spots, cysts, and oily skin, especially on the face, back, and chest. It can affect teenagers and adults. Acne is caused due to overproduction of sebum. Sebum mixes with dead skin cells and blocks the hair follicles, which can lead to blackheads and whiteheads. Usually, harmless bacteria feed on these dead cells, causing inflamed spots. Acne should be treated as soon as possible to avoid major scarring. Customers try several products to see what suits them best. I would normally advise to stop sugar. For some reason, people with acne getting continuous spots when they consume refined sugar. So avoid white sugar in all products. That could include cakes, biscuits, bread, anything such as tomato ketchup or any ingredients in ready-made foods. Try and read if there's any sugar included. Try and prepare your own food. Avoid foods that have got white sugar